Okay, so you know that feeling, right? Like heart racing, palms sweating, thoughts swirling around in your head. You're about to take a test and like you just know you're going to bomb it.
Oh, tell me about it. We've all been there. Test anxiety. It's that universal experience that can really throw you off your game.
Right. And today on this deep dive, we're going even deeper. We're looking at what's really going on in your body when those pre-test jitters kick in. So we're talking about those subjective feelings of, oh my gosh, I'm so nervous, but then also what's objectively measurable, like heart rate, blood pressure, even hormones, comparing the feeling with the hard data.
I love this angle. And the research you shared is absolutely perfect for this deep dive. It's a 2021 paper from the Educational Psychology Review. The title is a bit of a mouthful. Test Anxiety, Physiological Measures, Self-Report Systematic Review, Meta-Analysis. But basically, it's this giant compilation of studies that have looked at both sides of the coin, what people report feeling, and what their bodies are doing during tests.
Yep. And they even let us see some of the actual data tables so we can really get into the specifics of what all those different studies found.
Really cool.
So listeners, you're in for a treat. I feel like you and I always end up geeking out when we get to see the actual data tables.
Always.
But for you, the learner, the person who wants the core insights without having to wade through a ton of academic jargon, here's the deal. Today's mission is to figure out, does that gut feeling of test anxiety, the one we all know so well, actually line up with what scientists can measure?
Right, that's the big question. Do our perceptions match reality? And I think we might uncover some pretty surprising stuff along the way.
I think so too.
Sure.
So maybe before we jump into the nitty-gritty of all the research findings, let's quickly define what we even mean by test anxiety.
Yeah, definitely. So the paper defines it as a specific type of anxiety that pops up, well, obviously in testing situations, right? Before, during, and sometimes even after the test. And it's not just one thing either. Traditionally, it's been broken down into two main components. Worry, which is all those thoughts about performance, am I going to do well? Am I going to fail? All that mental chatter. And then the other side is emotionality, which is more about the feelings and the bodily sensations, like that tense, uneasy feeling, and maybe even some physical symptoms like your heart beating fast or your stomach doing flips.
Oh, I know that feeling all too well.
But more recently, researchers have started looking at test anxiety more broadly, also considering how it can mess with your motivation and even how you behave during a test. Like, do you freeze up? Do you get distracted? Do you avoid the test altogether? So it's not just about the thoughts and feelings. It also affects how you act.
Right, okay. So for a long time, the way researchers typically measured test anxiety was, well, kind of obvious. They just asked people.
Yeah, exactly. Self-report questionnaires. Straightforward. They give you a survey and ask you things like, how anxious do you typically feel in testing situations? Or how anxious are you feeling right now about this specific test? It's quick, it's easy, it seems to make sense.
Makes sense, but maybe not the whole story.
Yeah, you hit the nail on the head there. Because, people aren't always the most reliable narrators, even when it comes to their own feelings. I mean, think about it. You might downplay how anxious you're really feeling. Maybe you don't want to seem like a nervous wreck. Or, on the flip side, you might actually be more anxious than you realize. Maybe you're so used to those pre-test jitters that you don't even register them as that big of a deal.
Or maybe you just forget how freaked out you felt during the test once it's over.
Exactly. Memory can be tricky like that. So researchers started thinking, well, if self-reports aren't always the most accurate, what else can we use to get a more objective picture of what's happening during those test-taking moments?
Okay, so enter physiological measures, and this is where it gets really interesting. So we're talking about things your body does that you can't easily control, even if you try to. Like your heart rate speeds up, you start sweating, your blood pressure goes up, your hormones go haywire, all those physical signs of stress.
Yeah, exactly. And the thinking is that these physiological measures might give us a more direct, unbiased window into the actual physiological arousal that's happening in your body during those high-pressure test situations.
Like a sneak peek behind the curtain of your conscious mind.
Yeah, exactly. It's like your body's telling a story that you might not even be fully aware of.
So the central question that this giant research review set out to answer was this. How well do those two ways of understanding test anxiety, what you say you feel and what your body shows, how well do they actually line up?
Right, like are they telling the same story or are there some gaps, some inconsistencies? And get this, the research looked at over 30 studies. And the big takeaway is that there is a general positive connection between self-reported test anxiety and physiological arousal. And A significant majority, we're talking 21 out of 31 studies, actually found that the higher people rated their anxiety, the more their bodies seemed to be reacting. Higher heart rate, more sweat, all that.
So that's pretty strong evidence that when you feel those butterflies in your stomach before a test, it's not just all in your head, your body is really revving up.
Absolutely. And it makes sense, right? Test anxiety is a form of stress. And stress triggers a cascade of physiological changes in your body. It's like your body is gearing up to deal with a threat, even though in this case the threat is, well, a piece of paper with questions on it.
Right, exactly. But let's dig into the specifics now. I'm really curious to know what they found when they looked at individual physiological measures. So first up, let's talk about the heart.
Okay, so when it comes to the heart, they looked at two main things. Heart rate, that's the number of times your heart beats per minute, and heart rate variability, or HRV, which is a little more complicated, but basically it looks at the variations in the time intervals between your heartbeats. And guess what? Both heart rate and HRV showed a small to medium positive correlation with self-reported test anxiety. Meaning, more often than not, if someone said they were feeling more anxious, their heart rate was also a bit faster, and their heart rate variability showed some changes.
So it really is that classic feeling of your heart pounding in your chest, like it's about to burst out of your rib cage. The research actually backs that up.
It does, and it gets even more interesting. Some studies actually look separately at the worry component and the emotionality component of test anxiety. Like that classic study by Morris and Liebert way back in 1970, they found that both worry and emotionality were linked to heart rate, but emotionality seemed to have a slightly stronger connection. In a more recent study in 2001 by Cantor and colleagues, they found a similar pattern.
So both the racing thoughts and the uneasy feeling seem to be driving that heart rate up. Fascinating. Now, what about blood pressure? Does that also show this link with test anxiety?
Yes, it does. The meta-analysis found small but positive associations between both systolic blood pressure, which is the pressure in your arteries when your heart beats, and diastolic blood pressure, which is the pressure when your heart is at rest. Both showed a link to test anxiety.
Interesting.
And there's this one study from 2012 by Conley and Lehman that found something even more specific. They found that the worry component of test anxiety, all those thoughts about performance, seem to be a particularly strong predictor of higher systolic blood pressure during really stressful academic situations like taking a big exam. So all that mental chatter about failing or not doing well actually seems to be directly connected to a measurable increase in the force of blood pushing against your artery walls during those pressure cooker moments.
Wow. So it's like those worried thoughts are literally putting more stress on your cardiovascular system. That's wild.
Yeah, it is. And it just goes to show you how deeply interconnected our minds and bodies really are. It's not just one or the other. They're constantly influencing each other.
Right, exactly. Okay, so we've talked about the heart, we've talked about blood pressure. Now let's talk about sweat. I mean, everyone knows that clammy hands feeling when you're nervous.
Right. Oh, for sure. And researchers can actually measure that too. They use something called electrodermal activity, or ED, which is often measured as skin conductance. Basically, it measures how well your skin conducts electricity. And you know what? This measure showed a medium-sized positive correlation with test anxiety.
Interesting.
Yeah, so the more anxious someone reported feeling, the more their skin tended to conduct electricity, likely because of increased sweating. And this is a pretty interesting measure because it's tied pretty directly to your nervous system's fight or flight response, which is that automatic instinctual reaction to stress.
So even if you're trying to keep your cool on the outside, your body might still be betraying those underlying feelings of anxiety through, like, sweaty palms.
Exactly. It's like your body's giving you a little heads up. Hey, something's up here. We might need to be ready to fight or flee.
That's pretty cool. Now, what about cortisol? That's the stress hormone everyone always talks about. Did the research look at that too?
They did. And they found that cortisol also showed a small positive association with test anxiety. But here's the thing. The relationship wasn't as strong as for some of the other measures, like heart rate or skin conductance.
Why is that?
Well, the paper points out that cortisol levels are influenced by a bunch of different factors, not just anxiety. Things like the time of day, your sleep patterns, even what you've eaten recently can all affect your cortisol levels.
Makes sense.
And, there's a certain lag time with cortisol too. Like your heart rate can spike almost instantly when you feel stressed, but cortisol takes a bit longer to rise. So maybe that's why the correlation isn't quite as strong. It's like self-reports, which capture your feelings in the moment, might not always line up perfectly with those slower-acting hormonal changes.
Okay, so that makes sense. Now, there's one measure you mentioned earlier that I'm really curious about, and that's salivary pH. I've never heard of that being used in the context of test anxiety. What's that all about?
It's not as common, that's for sure. But the two studies that did look at it in this review actually found a pretty strong positive correlation between salivary pH and test anxiety.
Interesting.
Yeah. Basically, the more anxious someone reported feeling, the more acidic their saliva tended to be. Now, this is still pretty early research, but it definitely suggests that there might be a connection there.
Yeah, maybe something to explore in future research.
Sure.
Okay, so remember those two main components of test anxiety we talked about earlier, the worry and the emotionality. Well, the researchers were really interested in seeing if one of those components had a stronger link to the objective physiological measures.
It's a really good question, right?
Mm.
Because is it those spiraling thoughts that really drive the physiological response, or is it more about the feeling of anxiety itself?
Exactly.
Yeah.
So what did they find?
Well, a slight majority of the individual studies actually found a stronger correlation for the emotionality component, those feelings and physical sensations. But when they crunched the numbers across all the studies in the meta-analysis, they found that both worry and emotionality had statistically significant medium-sized correlations with physiological arousal. And, importantly, the difference between them wasn't statistically significant.
So basically, both the thoughts and the feelings seem to be playing a role in driving those physical changes.
Precisely. It's not just one or the other. They're both contributing.
Okay, so that really reinforces the idea that test anxiety is this complex interplay between your mind and body.
Totally. And it's important to remember that everyone experiences test anxiety differently. Like for some people, it might be more about the physical symptoms, the racing heart, the sweaty palms, while for others, it might be more about the intrusive thoughts, the self-doubt, the catastrophizing.
Right, that makes a lot of sense. Now, I'd imagine that the context of the test would also play a big role, wouldn't it? Like, taking a low-stakes practice quiz in a relaxed setting is probably going to elicit a very different response than taking a high-stakes final exam in a crowded lecture hall.
Oh, absolutely. The researchers really emphasize that context matters a lot. They point out that studies done in a controlled lab setting, where it's all very sterile and artificial, might not fully capture the physiological responses that happen in real-world testing situations.
Which can be pretty intense.
For sure. Like, think about the pressure, the time constraints, the potential consequences. All of that feeds into your body's response. And they actually found some studies that had conflicting results depending on whether the data was collected in a lab or in a more natural environment.
Well, that's really interesting. So it's like your body is reacting not just to the test itself, but to the whole surrounding environment.
Yeah, totally. It's like your brain is taking in all this information. Where am I? Who's watching me? What's at stake?
Hmm.
And then it sends signals to your body to react accordingly. And in one study, they actually found that when the test was very low stakes, like a practice quiz that didn't really count for anything, the correlation between self-reported anxiety and physiological measures was really low.
Oh, that's interesting. So it's like if the pressure's off, your body might not react as strongly, even if you still feel a bit nervous.
Right. Which also suggests that our perception of the situation plays a huge role in how our body responds. And this leads to a really important point for the learner to consider. If you can change your perception of a test, you might be able to change your physiological response to it. That's where things like mindfulness and cognitive reframing can come in handy.
Yeah, I love that. It's like you have more control over your anxiety than you might think.
Exactly. And the researchers also point out some of the challenges in measuring physiological responses accurately. Like in one study, they averaged all the different physiological measures into one big arousal index, which might have actually masked some of the more subtle relationships between individual measures and self-reported anxiety.
Right, so sometimes oversimplifying things can actually make the data less meaningful.
Exactly. And they also stressed that the choice of which physiological measures to use really needs to be carefully thought out and justified because different measures reflect different things. Like some measures capture immediate changes while others reflect more long-term processes. So it's not just about measuring something, it's about measuring the right thing for the question you're trying to answer.
That's such a good point. Okay, so bringing it all together, what's the main message we should take away from all this research on test anxiety?
The key takeaway is this. While your subjective experience of test anxiety, all those thoughts and feelings, is connected to those objective physiological changes that are happening in your body, those two things don't always match up perfectly. They seem to be capturing different but related aspects of the whole test anxiety experience.
So like two sides of the same coin, but not always perfectly aligned.
Yeah, exactly. And that makes sense because self-reports are capturing your overall experience. including your thoughts, your feelings, your memories, your interpretations. While physiological measures are more like a direct readout of your body's state of arousal at a specific moment in time.
And that's why the researchers suggest that using both types of measures together can give you a much richer, more nuanced understanding of test anxiety than either one alone.
Absolutely. It's like looking at a problem from multiple angles. You get a more complete picture that way.
Right. And that's the beauty of science, isn't it? It's all about constantly refining our understanding, challenging our assumptions, and digging deeper to uncover the truth. Okay, so the learner. What does all of this mean for you? What are the key takeaways you can apply to your own life?
Here are a few things to consider. First, remember that what you feel when you get test anxiety isn't just in your head. It has a real, measurable physiological basis. So that racing heart, that upset stomach, those sweaty palms, those are real physical responses that your body is producing. And on the flip side, it's also important to recognize that your experience of test anxiety goes beyond just those physical symptoms. Your worries, your negative expectations, those are all part of the experience too, and they can be just as debilitating as the physical stuff. So be kind to yourself. Acknowledge the complexity of what you're going through.
Absolutely. And remember, knowledge is power, right?
Totally. The more you understand about how your body and mind react to stress, the better equipped you'll be to manage those responses effectively.
So here's a thought to ponder, building on what we've discussed today. The researcher suggests that future studies could benefit from even more detailed ways of measuring both self-reported anxiety and physiological responses. Like maybe even looking at how different physiological systems interact with each other during test anxiety. And also how very specific types of worries, like worrying about failing versus worrying about looking stupid, how those might show up differently in your body.
That's so interesting, right? Like, imagine if we could pinpoint exactly how different thoughts and feelings translate into specific bodily changes. That would open up a whole new world of possibilities for developing more targeted and effective ways to manage test anxiety.
Absolutely. And speaking of digging deeper, there are tons of other avenues you could explore on this topic. Like, you might be interested in looking at research on specific interventions for test anxiety, things like mindfulness techniques or cognitive behavioral therapy, and see how those interventions affect both the subjective feelings of anxiety and the objective physiological measures. Or you could dive into research on how different people interpret their own physiological arousal during tests, like does a racing heart make one person panic while another person sees it as a sign of being pumped up and ready to perform?
Right, exactly. There's so much more to uncover. This deep dive is just the beginning.
So true. And ultimately, we hope this deep dive has given you, the learner, a valuable shortcut to understanding this complex, fascinating interplay between your experience of test anxiety and your body's reactions. It's a reminder that gaining knowledge often involves piecing together different types of information and looking at things from multiple perspectives. And we encourage you to keep exploring this topic and maybe even reflect on how these insights connect with your own personal experiences with anxiety. Thanks for joining us on this deep dive. We'll catch you next time.